We want to visit with Dr. Gopala Ramineni from the UPMC Hillman Cancer Center at IRMC. And our conversation is brought to you by Marcus & Mack, a law firm representing injured people. Good morning.
Good morning. How are you?
Wonderful, and it's good to have you on the air with us here today. You know, Dr. Ramineni, we visit with you once a year on this topic. We need to visit with you more because you have good information for us. The UPMC Hillman Cancer Center at IRMC. A lot of people might look at colon cancer and say, if I have to go there to Hillman, then this is too advanced and I've let it get away from me. That's not necessarily the case, is it?
No, absolutely not. I think there are a lot of novel changes with colon cancer treatments, so it's never too late, but it's always good to catch it early. I hope I answered your question right.
Well, there's no wrong answer in this respect. But we have focused with Dr. Clark and with others this month on prevention and getting those screenings and having the colonoscopy and the precancer polyps, getting those removed. Let's take it beyond that to if we did wait a little bit too long and colon cancer is evident and what the treatment protocols are for it, because that's where you come in and you're able to help folks to not only find hope, but to actually get on the road to a complete recovery.
So again, I know I'll divulge a little bit here. You know, I don't want to see patients. I don't want to see them when they're stage 2, stage 3, or stage 4. I want them cured in precancerous stage or stage 1, So that's the whole purpose. If there is one take-home message, get your scopes done, not 50 anymore, 45, because I'm seeing younger and younger people. And it is increasing in younger people. I really, really want to emphasize that. And, of course, healthy habits. So that's the most important take-home point from today. But coming back to the treatments, let's say, people get diagnosed with stage 1. Stage 1 in this day and age is cured in about 90% of the time. Stage 2, almost about 80% of the time. Stage 3, I would say about 70%. And even stage 4, people are living again, we talk about 5-year survivals. 5-year survivals is like a benchmark. It's like a 5-year warranty. It doesn't mean that, your car is going to break down at 5 years. So, but the benchmark 5-year survival for even stage 4 colon cancer is 12%. 12% is a pretty staggering number,
Yeah.
So coming back to the treatment protocols, stage 0 and stage 1, they're primarily surgical candidates. Stage 2, on a case-by-case basis, they may need chemo, some may not need chemotherapy. Stage 3 colon cancer patients, that is most often when colon cancer spreads into the lymph nodes around the colon when the surgeon removes the cancer, these people almost always need chemotherapy. And even chemotherapy protocols have changed. When I graduated from fellowship in 2005, we used to give them 6 months of chemotherapy, and now we're cutting down to 3 months in some cases. So we're getting away doing less but curing more people. And as I told before, even stage 3 is cured in about 70% of the patients. And stage 4, there are so many new changes. Yeah, as I was chatting with you just before, there were many days I always wondered if I was changing anything in patients' lives. And now I can say with these novel therapies, immunotherapies, and novel chemotherapeutic agents, targeted treatments, I can say that we have changed. We are moving the needle forward,
As you talk about the various stages that people encounter when they have colon cancer or in the prevention of colon cancer, And it really does emphasize the prevention aspect of it all. And it makes me wonder why it is that all of a sudden in the last 5 or 10 years, we're seeing younger ages at which people are getting colon cancer, so much so that the new protocols call for the screenings to begin at the age of 40 rather than at the age of 50.
Yeah, so good question. We really don't have a good answer for that. Again, I think maybe our diets, maybe our lifestyle, I think we've become more of a drive-through generation and too many processed foods. We consume less and less fruits and vegetables, So I think that may have a big role. And I think we're screening more. Maybe we will find some patients at an earlier stage, and we're more aware of these people that have hereditary cancer syndromes, so maybe we're finding them earlier. So, yeah.
Let's talk a little bit about Hillman Cancer Center and how it works with IRMC and the advantages IRMC has from having Hillman in partnership with IRMC. It really is a tremendous advance for here in Indiana County, isn't it?
I would say yes. I want to be modest here. I'm really thankful. As I've told before, I'm really thankful that I have the privilege of taking care of patients in Indiana County and now in Punxsutawney as well. Me and my partner, Dr. Kamanova, goes there once a week, and I must say we have excellent resources, whether it's clinical trials, whether it's a second opinion, whether if it's a complicated case. We have excellent resources, resources that you would get if you went to UPenn or, if you went to Sloan Kettering, So I'm blessed to have that. And we have a lot of patients on preventive, not as many on preventive clinical trials, but treatment clinical trials. And again, I think the care that people receive is the standard of care that they would receive elsewhere, and they don't need to travel. They can get it right in their back door.
That's amazing because, for years and years, maybe people wouldn't even bother going in for pre-cancer screenings or for getting an aggressive treatment of colon cancer or any other cancer, simply because of the distance and the inconvenience of traveling to Pittsburgh. It is a very, very difficult thing. But to be able to get that standard of care right here in Indiana and now in Punxsutawney as well is just a tremendous thing. What do people or should people expect when they walk through the doors of the Hillman Cancer Center? I know that it can be a very intimidating experience for people who have no type of background with cancer or with cancer treatment to walk into that cancer setting for the very first time.
I think, most of us, cancer still carries a significant weight. Chemotherapy still carries a significant fear, associated with it. And I think, I must say, things have changed. Chemotherapy, we're able to use it better. Cancer treatments have gotten better. And as I'll reiterate, people need assurance that they're going to be okay, and that's what we strive to provide. And in cases where we can't cure them, we want to keep them comfortable, and we want them to live as long as we can. So that's what they can expect: compassionate and passionate, and a standard of care at our cancer center.
It really does, though, as you say. It starts with catching it as early as possible and making sure it doesn't advance from there. And that just screams out to us, get the screening, get the colonoscopy, and take care of it now before you have an indication of trouble rather than after.
Correct. Prevention. And the one other point that I like to stress is, again, people talk about colon prep. I mean, I had a colonoscopy myself, and I didn't have any problems getting the preparation. But again, not all of us are the same, and there are different types of preparations. You can ask your gastroenterologist or surgeon. We have plenty of physicians that do colonoscopies, and people think Cologuard is enough. And I would want to stress again, Cologuard is not enough. It's not a replacement. I mean, if you really are stubborn and not want to do colonoscopies, maybe Cologuard is okay, but, it's not a substitute. And I think get the screening done earlier, 45, is more important.
The happy little box might be a little bit helpful, but there's a much, much better thing that you can do for yourself and for your family. I think that one of the things we need to emphasize more in today's world is that when you're getting screened for any type of cancer, you're doing it not only for yourself, but for your family members.
Absolutely. I mean, the cost and the morbidity and the stress associated with it ripples through a family. When someone is sick in our family, I mean, it does ripple through. So, yes.
Absolutely. Dr. Gopala Ramineni, thank you so much for spending some time with us this morning. We appreciate it.
It's my pleasure. Take care.
Have a wonderful day.
Have a great day. Take care. Bye-bye.
And it is the voice of Indiana County, WCCS 101.1 FM and AM 1160.